Welcome, everyone, to Cancer in Context. I'm Dr. John White. I'm the Chief Medical Officer at WebMD. There's certainly been a lot of advancements in cancer treatment and diagnosis over the past year. But what do people really need to understand? And let's be honest, workloads have become more intense. Are we still talking burnout? And what do we need to do? Joining me today is the president of the American Society of Clinical Oncology, Dr. Robin Zahn. Robin, thanks for joining me today.
Thank you so much, Dr. White, and it's a pleasure to be here.
As you may know, I worked at the Food and Drug Administration prior to coming to WebMD and Medscape, and I was always fascinated by the number of new drugs in cancer that we see every year. So I wanted to get your thoughts. What have been the latest advances that you've seen are really changing how we practice oncology?
Well, I'm going to rephrase that about what are we actually going to be seeing at ASCO this year. And just as a review, the ASCO annual meeting is where our cancer specialists will hear the latest in groundbreaking oncology treatment and patient care. And in fact, there's over 5,000 research abstracts that will be presented. And there's a few themes I'd like to share with you that come to mind. First is improving outcomes with less toxicity. And this is a trend that we've been seeing across a number of cancer types. And it really informs us on how we can use existing treatments better, but with less side effects. Certainly, in taking care of patients on a daily basis, we're always trying to find ways to optimally get the effectiveness, but at the same time reduce the toxicity so they remain compliant with our medications. So we have several studies that are looking at the role of de-escalating treatment while improving outcomes, as well as how can we sequence treatments that the resulting outcomes can then allow us to further personalize the treatment and in some cases omit or change the therapy because the treatment didn't work as well as it should have, or the treatment worked so well that we don't need to continue any treatment after the outcome. So tech innovation is also a very highlighted area that you'll see in our meeting, and several studies and special sessions are focusing on the new uses of technology in cancer care. For example, telehealth. We've been using telehealth with the onset of COVID, but now we actually have some abstracts that support its use and effectiveness. For example, in providing effective palliative care. Artificial intelligence is able to reduce disparities, and we have an abstract that's supporting that in its role in colon cancer screening. Then we have new strategies for sampling of blood to detect what we call minimal residual disease to guide treatment. In the area of prevention and early diagnosis, we have studies examining the long-term risks of hormone replacement therapy. And very exciting, especially in my world, is the effectiveness of HPV vaccination for preventing a wide range of cancers among both girls and boys. So there's an abstract that is proving this value, which I think is extremely important because as of 2022, only 58.6% of the U.S. adolescents currently aged 13 to 15 years have received the 2 or 3 doses of the HPV vaccine as recommended. And globally, since we are a global organization where prevention also is very important, just 1 in 8 girls are vaccinated against HPV. And as you know, in many parts of the world, cervical cancer is a primary cancer that could be prevented.
Right. And we see its association, with throat and neck cancer as well. So, Robin, something I wanted to ask you and to have a robust discussion around is what are the unique challenges that community oncologists face in clinical practice in terms of keeping up with the emerging data and the new advances?
So some of the challenges that we face is really are not unique, not anymore, at least to the community setting, because even in the subspecialties, there's so much volume of information coming through that could be a problematic. But from the standpoint of the community doctor, we not only are dealing with the volume of data that we have to be able to sift through because so many of us are general medical oncologists and see all the cancers, but also the administrative burden associated with managing that cancer when it comes to getting our treatments implemented for our patients. So clearly, as you must be very well aware, oncologists and medical professionals in general have this larger bank of knowledge now that we need to be able to manage. So what's one potential solution? How can we digest that knowledge and serve it up as actionable tidbits may in fact be artificial intelligence? So we have an exciting opportunity to examine the new and emerging AI tools to try to find ways to help clinicians and patients take advantage of all of the research and the knowledge gains that we're making each and every day in our field.
We put out a report earlier this year on Medscape about burnout. And what we saw that the issue of burnout is not going away. And it's well documented that the community practice-based oncologists are overwhelmed. How would you like to see them better supported?
Well, we turn challenges into opportunities. And we know and we acknowledge, and I've experienced in my own practice, oncology practice are facing a lot of increasing pressures, regulatory burdens, administrative tasks, acquisitions, workforce shortages, and of course, as you mentioned, burnout, and it's all tied together, are the real issues that we're particularly seeing at the community level and other practice levels as well. And as you know, I've been a long term advocate on behalf of the community. But ultimately, I want all clinicians, wherever they are, to have the resources available to them to be able to deliver high quality, equitable patient cancer care. So, as an organization, ASCO is looking how AI, again, can try to reduce administrative burden. For example, we're looking at ways to use large language models and generative AI to reduce the time cancer care professionals spend on the tedious documentation tasks. To that end, actually, ASCO will soon be publishing a guideline for clinicians on using AI in practice that can help our members find ways to be more efficient. We are also looking to innovate and develop tools to assist practices and the care team for advocating for their patients with regards to the business dealings. How can we deal with our business administrators, our payers, our community stakeholders, including our local employers that often are funding the self insured plans that our patients have in terms of health coverage? So, we're developing a business playbook that will educate on basic business chapters that are relevant and necessary for clinical care. So, by providing the providers with tools and resources to help them address the business side of the practice, we want to empower our colleagues to effectively and efficiently advocate for the needs of their patients. We're also empowering patients to advocate for their needs alongside their oncologists because we understand that patient care involves both treatment and advocacy. And finally, and not lastly, we appreciate that the optimal care of a patient is team based. So, ASCO has developed a care delivery model called ASCO Certified, which helps practices integrate medical home standards that promote high quality, equitable care. And this model can be actually utilized by all practice sizes, including community and academic, and sites of service that provides a comprehensive roadmap to high quality care for the entire patient journey.
Now, you and I are talking at a time of graduation. People are graduating from medical school. We saw the match just a few months ago, but let's put it out there. We're having some workforce shortages, including in the field of oncology. So, what is ASCO doing to address oncology workforce shortages?
That's a great question. And ASCO actually has projected that there would be significant shortfalls of oncologists by 2030. So, among the steps that we have taken is the establishment of a workforce monitoring system that tries to track the numbers and distribution of oncologists. It can't be precise because things are changing so quickly in the oncology space. But we are seeing those stresses, as you might imagine, that are in fact increasingly stretching our workforce, in addition to not only increasing levels of burnout, but difficulty attracting and retaining staff. We're having the same problem, where we were locally and having to compete with other sites of service around my own practice with MHL. So there's a trend, as you also know, towards practice consolidation and growing access issues, rurals being one example. So now you intersect that with the need. Cancer patients are living longer. Many of them are getting additional cancers, and we're seeing cancer cases on the rise. So not only do we have an increased need, which is a great problem to have because we're successfully treating our cancer patients, but then that is intersecting with the workforce shortage. So to address that, ASCO is taking a two-pronged approach. The first is what can we do to support our workforce today? And secondly, how can we attract new, diverse clinicians in this very exciting, what I consider the best field of medicine you can be in? So, with regards to the first prong, one approach is to embrace the power of mentoring. So, in my experience, mentorship has played such a huge, tremendous part in not only my professional development, but also my sense of personal fulfillment. And I've learned so much from my mentors, and I've been able to give back as a mentor myself. And I truly believe that as experienced oncologists, that we have a responsibility to mentor the next generation. So I'll give you this example that just happened 2 weeks ago. I happened to be presenting at FLASCO, which is the Florida State Oncology Society, and there was a young man sitting at the table, and I introduced myself to him, and we started talking. He goes, "I know you. Do you remember me, Dr. Zahn?" I said, "No, I'm sorry, I don't," because he was older. He goes, "14 years ago, when you were in your daily practice at Michigan Hematology Oncology, I shadowed you." And he spent some time with me. I don't remember the amount of time, maybe a couple weeks. He goes, "Because of that experience, I am now a medical oncologist."
Now, one of the success stories in cancer care is that people are living longer. And in many ways, we're so focused on diagnosis and personalized treatment that I wanted to ask you, how is ASCO leading the charge to provide continuity and coordination of care for the increasing number of individuals surviving or living with cancer? Because we didn't see as much of that 10 years ago, and now we're seeing much more.
Very importantly, is coordinating amongst the physicians and working with sister societies and other organizations to coordinate survivorship care. Because as a team, we have our patients, but we also work with primary care docs, for example. So just earlier this month, ASCO had published a guideline with the Society for Integrative Oncology on the management of fatigue in adult survivors. So it can help with physicians at any discipline who see these patients. In addition, MASC, which is MASCC, ASCO recently published the principles of quality survivorship care for people affected by advanced and metastatic cancer, just published in May of 2024. And those principles then will be able to be used in a number of ways, including all the stakeholders in cancer care, including other providers. And finally, to help the general and family practitioners and other patients, other doctors that see our survivors, we've actually created, ASCO has created a robust collection of survivorship information under guidelines on survivorship care to help these doctors.
No, Robin, I just have one more question, and first I want to thank you for taking the time that you've given us today. What are your priorities as ASCO president?
With regards to my priorities, I'm really going to share with you my theme. Okay, I'm really excited about it, and it's driving knowledge to action, building a better future. As we know, the power of knowledge, when universally applied, can create positive change. It's this application that will improve cancer outcomes in a high quality, equitable manner, but also help our field better solve problems and make informed decisions. And all of us, leaders, researchers, clinicians, patients, payers, government agencies, and employers need to be committed to equitable care, evidence-based decision making, because together we're stronger than cancer. But there's three pillars that I intend to invoke to help us achieve this. Emerging technology. For example, how AI, as we discussed before, can not only assist closing knowledge gaps, but ensure patient-centered AI and then reduced administrative burden. Empowering advocacy. Advocacy is at all different levels. It's at the evidence-based advocacy by using data to inform policy decisions, increase participation in our state affiliate council, getting more of our ASCO members from all types of practice settings to be engaged in our ACT network, and finally, empowering our members at the local level to advocate for the needs of their patients and themselves, hence the Business of Oncology Playbook. And the third pillar, embracing community. By sharing our experiences and our global membership, we can continue to do what ASCO does so well, which is a convener. Convene various communities and network and design strategies to solve problems. And furthermore, I'm going to be challenging. I'm going to be challenging our communities wherever they may be to invest in local STEM and workforce development, including mentorship, as I just shared with you earlier. So ultimately, my goals are 100% aligned with ASCO's, conquering cancer through research, education, and the promotion of highest quality, equitable care.
Well, Dr. Robin Zahn, I want to thank you for all that you're doing on behalf of cancer patients, as well as your oncologist colleagues. We're lucky to have you leading the charge at ASCO, so thank you.
Well, thank you so much. And on behalf of ASCO, thank you for giving us the opportunity to be able to showcase all of the wonderful work that we'll be doing, we've been doing, and we'll continue to do. Thank you so much.